Welcome to the Roetzel HealthLaw HotSpot. HealthLaw HotSpot is a podcast for physicians and health professionals that covers the legal issues and trends that affect the healthcare industry.
Hi, everyone. Welcome to the HealthLaw Hotspot. I'm Ericka Adler, shareholder and health practice leader at Roetzel and Andrus. And today I'm joined by Kate Othus. Kate is the founder and president of DataDX and the president of Health Professionals Alliance. And today we're going to be talking about a really important topic to me, which is independent physicians and independent practices. And this is something that I know Kate and I have talked about as something that she's very passionate about. And so I'm really excited to hear from Kate and have all of you hear about her involvement with private practices and why she's so committed to them. So welcome, Kate. And why don't we start by having you just tell us a little bit about what you do, who you are, and why you're passionate about independent practices.
Sure, thank you. I'm happy to be here. So with private practice, that's where I've spent the majority of my career. Let's say the first half. I was working directly with doctors, side by side, helping them lead their practices, and primarily in specialty groups. So surgical groups by and large, plastic surgery, dermatology, orthopedics, and then other groups as I transitioned into consulting. It's really fun to actually transition to consulting because when you go from being an employee to a consultant, doctors actually listen more to you. So that was a fun transition. And working side by side with physicians presented a lot of opportunities to help look at strategies to grow and ways to build sustainable solutions inside of their practices. They need to focus on seeing patients and providing quality care. And I was able to help work with the teams on building efficient operations, good clinical procedures as far as what the staff needed to do to help the doctors. And one of our goals was, depending on the building we were in, but if the patient has to get in the elevator, once those doors close, they remember what the doctor told them to do or what that treatment plan was. And if they didn't, then we didn't look at that as a success. Transitioning into Health Professionals Alliance and DataDX, DataDX was created from years spent working with doctors in their practices and trying to develop good financial reports in real time, which was nearly impossible. All the systems are siloed and the billing offices have to close, the cash has to be reconciled, and our administrative teams are small typically and very savvy in certain areas, but usually resource constrained. And so, you're on financials working 45, 60, sometimes 90 days, in the past. And so if you're trying to understand key drivers in the business, that becomes incredibly challenging. Furthermore, if you're working in Excel, you're subject to making a mistake, not on purpose, but it just happens. Numbers get composed. And so DataDX was born from the idea that there has to be a better way to produce financials for physicians in real time and help them understand the drivers so that they can make meaningful changes and pivots in the business when needed to help prevent issues, challenges, pitfalls, what have you, cash flow issues, see revenue cycle problems, optimization, and even utilization of facilities, because they're sometimes not really looking at how are we leveraging our exam rooms? Do we have the volume to sustain our healthy overhead, or are we taking a little bit too much time off or spending too much time with one type of patient and not enough time with another? And so giving them meaningful data helps them understand how to better organize their businesses. Health Professionals Alliance is born to help physicians. It's an alternative essentially to private equity and hospital-based employment arrangements. And the idea behind Health Professionals Alliance was actually born from conversations with physicians. In particular, a group of physicians that had just entered into a private equity deal and became very frustrated, angry almost with the deal that they had just signed about 12 to 16 months after the deal was executed. They felt like they were sold a bill of goods and the promises weren't met. The profits didn't improve. The impact on the clinical side of the practice was more than what it said that it would be. Typically, when you experience a private equity deal, the transaction is supposed to be on the non-clinical assets and supposed to leave the clinical care out of the deal, out of the operational management and control. There's usually a tax or overhead fee that's paid for some type of management services, billing and marketing and whatnot. And clinical care is supposed to be left to the doctors. But what usually happens is, because the goals of some of these organizations are to improve margins by 20 to 30%, well, that means they need to see more volume. So that definitely impacts their schedules and their clinical time, but also sometimes it impacts the codes that they have to use. And so these two organizations were born to help fuel private practice, bring more profitability, resources, and solutions that are an alternative. So DataDX and Health Professionals Alliance work together. The DataDX sits at the core as a technology-enabled solution to bring those business insights to the practice. And HPA is a membership organization, essentially, that fuels them with the services. So, sorry, long-winded answer.
Really interesting. And I know what you're talking about with private equity deals. We handle a lot of these, and I think the doctors go in very excited with a lot of the promises that are being made. And I think it's no surprise that sometimes things don't work out as planned because, they're in it for different reasons. A lot of times physicians are in it to serve their patients, serve the community, to grow, research, development, whatever it is they do in their practice. And private equity is really in it for profit and, and maybe to grow and sell, right? So sometimes there's a little bit of a conflict between their goals. And I do think a lot of my doctors enter into private equity deals because they feel there's no other choice, that that's where things are headed, or maybe a hospital hasn't been interested in acquiring them, or they feel like they can't compete anymore with, some of the bigger groups or private equity owned groups in their neighborhood, right? So, often they don't want to, and they're nervous, but they feel they have no choice but to do that. So I guess what I'm curious about is, if I'm an independent practice and I am trying to stay alive and stay independent, you have talked about two different components that you work with practices on. And one is the technical side. So let's start with that. So if we're on the technical side of things and we use something like DataDX, the idea is that before, where we didn't know what was going on, or where we didn't have the capability to run certain types of reports, or we had to rely or didn't want to spend the money on outside consultants to give us that information, now we can do it ourselves. Is that kind of the idea?
That is the idea, exactly. The tool, essentially, it's AI driven and based. And so after the data is pulled into the tool, there's predictive analysis that are applied across their data, and helps them see what the trends have been, where they might be changing, and provides recommendations to alternative plans that they might take. At the core of the platform, we have a team of consultants that's also watching these trends and working with the data engineering team to make sure that the recommendations that are produced through the AI are meaningful and what you're actually seeing with inside healthcare practices. So there's a nice human element to where we're trying to be very scalable and use our technology wisely. We also have that human element that's bringing the business acumen and experience to those reports or to the recommendations fueled through the tool.
So when you see that data and then you go to the practice, or the practice gets a recommendation about changes they can make, improvements they can make, and then do they usually go ahead and implement, and do you measure those types of improvements? And what would be some good examples of some types of recommendations or improvements that are made?
That's a great question. There's several different areas. There's four common areas that we work within. Contracting is one. So there's a lot of rate modeling that we can provide by analyzing the contracts that they have and the procedure codes of payments that come in currently through the payers. There's a lack of optimization of those contracts and understanding if they're even getting paid on a contractual basis. And while it is becoming harder and harder to negotiate with the health plan, it is still possible. And so it's really important to bring good data to those conversations, and again, understand what the fee proposed changes might be and the impact. So that's one big deliverable through the tool. We have seen this year actually rate increases of around 5% in certain areas in the country, which, we haven't been able to say that for a while. 3% or 2% was actually pretty average for several years. We work with people like you, of course, to do the provision reviews and whatnot. Provider credentialing is something that actually the tool helps benefit the practice within. There are commonly credentialing issues that delay billing. And so we'll point the practice into that area. And we also offer credentialing through the tool as well. growth initiatives. So understanding the patient population that the practice is serving and what areas for growth there might be. So this could be through like a zip code analysis and a heat map, understanding where the patients are that are coming to your practice, potentially also understanding your referring physicians and any referral pattern changes and making sure that they're nurturing those relationships. And again, layering that heat zone or heat map over the top to make sure that they understand, any new trends or changes, because a referring physician is very important. They usually have 10 that they rely on to bring in patients to their practice.
All right. So I guess, what then? So if we're talking to a practice and we say, here's the technology piece with the support and everything that we can bring to you. And then we pair it again with the other services that you're providing, which you describe more as, kind of it's a network, or how I'm trying to think of the words that you use to describe it. What are the kinds of things that they get by participating in that helps support their practice? Like, why would they want to be part of that?
That's a great question. So it's resource driven, essentially. So what are the resources that the practice needs? There's no mandates. They can choose. There's a menu of resources that they might need. So some of the practices are going to have a really great marketing provider. Others are not, as an example. Some may need recommendations for a different EMR system. They're unhappy with that, or need revenue cycle optimization. So code reviews, as I mentioned before. IT and HIPAA compliance, have another vendor that does that for our clients. So essentially, when a practice joins our alliance, we will do a practice assessment and help them identify basically quick wins that will help with either top or bottom line improvements within the practice. So, we have currently 20 different basically healthcare businesses that are service providers to medical practices. And we have about 30 more businesses that we'll be bringing on as strategic partners over the next quarter. So that way the physicians and dentists, essentially, because we have both within our network, can pick and choose what's best, or they can ask us to help them with that. It kind of depends on their infrastructure and resources. So we try to augment and then help drive improvement. And we'll walk our clients through kind of a phased approach, so it's not overwhelming, because obviously we're asking them to make changes, which is already hard. I mean, we don't drive banking changes or things like that, because that's a very onerous exercise for the practice, although we may recommend a merchant change because we have a better fee with the merchant service provider. So those are some real small examples, but they can drive immediate improvements. And bottom line improvement is great, and where revenue strategies are there to tweak, then we can help practices with that as well. Everything we like to look at like growth-based thinking. So
these are really ways that if an independent practice is struggling, they don't have an MSO managing them. They don't have, they can't afford a management company or maybe a full-time CEO or whatever it is. So this is kind of like a variety of services that help take them to the next level, help offer them those services that they may need, that they don't realize necessarily that they need, or that they may save money on, essentially. So how big an alliance is this? Is this your plan to kind of make this or is it already national, or is that your plan? How big is it?
So we have members across 13 different states. We have 40 founders at this particular point in time, and we're looking to add our next 100 doctors across the country. So yes, national-based organization, and looking to grow very rapidly and across multiple specialties, and also trying to offer a primary care-based initiative as well.
Right. So what are some of the things that you hear from doctors that they find to be the most challenging? I know, some of my practices are doing great. A lot of them have indicated that, what they find frustrating is that people assume that in a private practice, you can't make as much money, that it's too hard to stay independent. And I don't know that the benefits can't be comparable. Those are really, and I often talk with my doctors about how they can attract really, great talent. How do they compete with the hospitals or the private equity owned companies? Is this something that you also talk about with your clients?
Absolutely. Competitive wages is a big issue, especially now with COVID and just getting people to come back to work in certain states. Oregon's one that in particular has an issue with that. Benefit packages, the cost of a health plan for a small provider is exorbitant. And so it's typical for a small business owner to actually try to share the cost with their employee, which they can't afford, and that might be a high deductible plan. And so we're also working on an insurance plan that is consolidated for our members that they can get at a better rate, and working on other ways to design benefit packages for the practices that would, again, help, like you said, with competitiveness in the marketplace. And it could be different PTO packages. It could be some work from home arrangements on the administrative side. There's other ways to do it, but you have to be creative and open to it, but it also can't bottleneck your business. And so it depends on what type of practice that we're working with, but there's some other strategies that healthcare is starting to adopt that's helping them.
Do you still find that once you're working with practices that they still end up, selling or merging, or are you really seeing that these practices, once they come on board, are able to successfully stay independent? I guess I'm still seeing a lot of sales going on, and I'm just curious as to whether those types of alliances, so to speak, can help kind of turn things around.
I think that over time that we're going to, we had 3 of our members actually present deals to us that they had been presented to from different types of private equity firms. And, we advise them to build a team and make sure that they are properly analyzing the opportunity, the economic, ethical, practical implications, cultural that's going on. Those 3 deals in particular, the doctors decided to walk away from, but locally and nationally, there's even the last 3 weeks, there's been a lot of news around different buy sells that are going on inside of private practice space. So it's definitely on the uptick as far as the trend right now. It is the trend to join a hospital-based group or be bought out by private equity because of the cash that they're offering the practice.
Yeah, we're definitely super busy with private equity deals right now. I don't know if it's post-COVID craziness or what it is, but there is definitely a lot going on. And obviously we work with so many independent practices, and many of them have been in business for a really long time. So we're really interested in helping them find solutions to stay independent if that's what they want. Exactly. A lot of times we may have doctors who are close to retirement. They don't have younger doctors in their practice to take over, and it may be a perfect fit for them, get the money, work for a couple more years and be done. And that's their goal. But where we have practices that can't stay alive and want to stay alive, we're certainly looking to help them find options to be able to do that. So this is really kind of like an alternative route for physicians to consider. Is there anything else you think independent practices really need to know about their options that other than just it's possible, just get the right support and you can do it, which I think is kind of the only way that I know for sure.
Right. I mean, I think they have to step back and consider what their goals are. Are they looking for an exit strategy? Why wouldn't they want to sell to another doctor instead of to a big firm, as an example? I mean, they started in a small practice as a possibility and have had enjoyed having that autonomy and creating that culture with their patients and their team. And patients like going to a private practice by and large and getting to know their doctor. We're, by our nature, is to be relational and have that connection. And that's hard to do in a big healthcare setting. It's easier inside of that practice. And so, we do want to present options for our doctors. We want to make sure that they're educated about all of that's in front of them. But we also want to make sure that they understand the goals and mission of that organization that they're joining. And it's not just margin improvement. There literally is mission and heart there.
Right. And I think, I always say this, like we talk about independent practices, but there are some practices that, being acquired by a hospital was just the right thing and it was a perfect fit and they're very happy. Same thing with private equity. For some people, it does work out really well. So I think I think measuring and considering if it's the right deal for you and what the terms are. Can you reacquire your practice if things don't work out? What type of planning can we do? And the other thing that I always try and focus on is, is it going to cost you more? So a lot of the formulas when you go to do those kind of deals talk about the idea that you're going to get X amount, and maybe it's collection, maybe it's RVUs, but a lot of that is tied to the success in collecting, right? So if you have a practice that does a great job collecting and they then get acquired and they try and give themselves the same formula, but they don't collect as much with the buyer, then that compensation package is not going to stay the same. The same thing if the buyer then tries to go and negotiate new payor contracts that aren't as favorable. So I think, all these things you're talking about that the doctors control in their private practice, they give all that up when they go work for someone else. So I think you can do a deal with somebody, but you need to think about it about what it is to run your own practice and make sure that you're still thinking about those concerns when you sell. And then again, if you're not happy, being able to take that practice back. So I guess, selling doesn't have to be the end of the road, right? It can be maybe a bump in the road if it doesn't work out. Have you had any practices that you have helped return to independence at all after? I know you talked about that one that regretted it about 15 months later, but is that a trend you're seeing where people are undoing their deals?
Well, the deals are hard to undo, as you've probably seen. And so the few that have approached us that have wanted out, there was no way out. So they have to write out the term of the agreement. It's more common for us not because they don't feel like they can get out of the private equity deal, or it costs too much money, let's say. But from a hospital-based arrangement, we're running analysis and helping groups set up new practices and roll out of those type of agreements. Those are typically easier, I guess, I would say, to transition out of. And so what we're doing is trying to create, it's all about timing. So by the time, we can grow and within certain markets, what our hopes are is that when these contracts with private equity firms, with the physicians and dentists that were unhappy with them, when they're ready to roll out, that we're there to support and have that infrastructure to surround, so that it's scalable, it's fun for them. It creates a good ecosystem that they can thrive and flourish in.
Right. And, there was a survey a few months ago, I think you and I may have spoken about this before, that showed a decrease in the number of independent practices out there. Yeah. And I think, the survey was somewhat misleading. And I've said this before, because I think the doctors, I just don't think it fully reported all the independent doctors that are out there. But I also still see a lot of brand new practices that are starting up. So I feel like it was a little discouraging to see that survey, because it kind of gave the impression that they're on the way out. But in fact, for everyone that we sell, we help start a new one. So correct. I feel like we're really seeing that. So I'm not really seeing the decrease that was shown in that survey. I don't know what to believe. Are you seeing a lot of physicians starting brand new practices? Maybe not right out of training, but just generally kind of taking a shot at it?
Absolutely. I could point to several that I know, and some of those have resulted in they were part of a group, and some of the group rolled into a hospital-based type arrangement as an example. And a few of those doctors, maybe there's 10, 15, decided, nope, I still want to be independent and autonomous, and let's start this myself or ourselves, depending on the size. And so I've seen more of that, where it's fragmented out from a major decision that's been a roll up and then a roll out. Mm-hmm. Younger doctors, that's where I'm a little uncertain about what that trend looks like right now, because it's hard to catch that. That's a stat that you see a year or two later, as far as what, our new doctors that are graduating from medical school, what are they doing? I think they're being advised to basically shop around. There's a lot more options for a younger doctor than there was even 5 years ago, right. Because of how hot consolidation is right now. And there's more money in some of those deals for a younger doc, but the arrangements, they change over time. And so they just need to be really careful about those opportunities. I think they really need to look at what type of doctor are they, and what type of a system is best for them. Are they academic based? So they need to be in an academic medical research center. Do they like the thought of the panache of being a business owner, depending on your feelings on that matter? Or do they want the collegiality of working with a group? And so I hope they don't get lost in just the transactional side of, what does that business opportunity look like, but what's the right environment also for me and the patients that I want to treat and serve.
Right. Yeah. And I work with a lot of residents and fellows coming out of training, and I think some of them will just consider any offer given to them. They don't necessarily have a preference. It could be geography. It could be they have loans to repay. It could be going back to where their family's from. So there's a lot of different things that affect their decision making. And then of course it comes down to money. And I always say to them, look, when doctors come to me upset with their job, it's very rarely about the money. It's usually about the lifestyle. And I try to emphasize to them that, life is short, obviously, and you want to be happy. You want some say in your day-to-day life, how much you're traveling, what your schedule looks like, etc. I think sometimes young doctors are just so excited to get a job. They haven't started their families yet, or they're not really thinking about that. But, the biggest complaint I get from doctors that are in practice and unhappy with their job is about those lifestyle factors. So I really try and say to them, what is important to you? Do you want to start a family? Do you like having flexibility on your schedule? And there's always going to be those doctors where they say yes, and other ones like, no, I work hard. I don't really care about that. I don't care how much I travel. I don't care. I just want as much money as possible. Well, there's a job for everyone out there, right? But I do think that a lot of them, especially after COVID, where we're thinking about our lives and, being home with family, et cetera, really keen on rediscovering that. And maybe telemedicine will play a role in helping, these independent practices grow even more, where doctors can find a source of additional revenue and additional freedom. But I really do think we're going to start seeing some more independent practices. I know we just said we're seeing huge uptick in private equity, but I still think there's a huge population of doctors out there where that independent practice is the right fit for them. And I think, especially coming out of COVID, I'm definitely seeing that.
Mm-hmm. I would agree.
All right. So I think we've kind of covered everything that we planned to cover. Do you have any final comments that you want to share?
No, I just appreciate the conversation and dialogue. And I'm hoping that physicians realize that there are options for them, and there are organizations out there that are trying to build resources that will help them enjoy private practice and continue to flourish.
Great. Well, this has been really helpful. I hope you'll come back and tell us a little bit more about the trends that you're seeing. And if anybody has any questions, they can definitely reach out to Kate directly. We'll have her contact information when we post this, and they can certainly find out more about her alliance as well as her company. And we will share all of her contact information as well. So thanks for joining us. This has been the HealthLaw Hotspot, and I'm Ericka Adler, and we hope to see you next time. You can find out more about us at ralaw.com, and you can check out all of our previous podcasts on YouTube by just Googling HealthLaw Hotspot. Thanks, and we'll see you next time.
Thank you.
Thanks.
The Roetzel HealthLaw Hotspot is made available by the firm and its attorneys for educational purposes and to provide general information, not to provide specific legal advice. Use of the Roetzel HealthLaw Hotspot does not create an attorney-client relationship between you and the firm or any of its attorneys. The Roetzel HealthLaw Hotspot should not be used as a substitute for competent legal advice, and you should contact an attorney in your state about any legal needs or questions you may have.